American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary-Faye Axon Armstrong.
Warm greetings for everyone. This is Annalyn from Toronto, Canada. We welcome you to a Healthy Monday with Asian American Pacific Islanders Nurses, AAPINA of Nevada. And as I've mentioned earlier, I am Annalyn Patag. I'm filling in for Dr. Mary-Faye Axon Armstrong, who is the founding president of AAPINA of Nevada and AAPINA of Hawaii. On behalf of my nursing colleagues here in Canada, I would like to express our gratitude to Dr. Mary-Faye for this opportunity to share our nursing insights and perspective regarding COVID-19 and its clinical implication to our nursing profession in general. May I introduce to you our three guests for today. I have Miss Mary Beth. She is currently positioned as COVID nurse screener at Trillium Health Partners. I also have Sarah. She is a personal response associate at Teleperformance in Montreal. And my gentleman for today, his name is Humphrey. He is our safety officer at Trauma Bay Sunnybrook Hospital. Before we do the formal discussions in regards to our topic for today, let me share you some statistics in Canadian COVID cases and our vaccine distribution plan. So these informations are updated from yesterday. We have confirmed cases of 725,507 of COVID cases across Canada. And deaths up to date, 18,462, and recovered cases of 638,632. So amongst the confirmed cases, we have the following provinces who had the highest number of COVID cases, and they are Quebec, Ontario, and Alberta. We follow as Canadians the federal government's vaccine distribution plan. Primarily, we distributed all the hospitals with Pfizer vaccine, and the Moderna is allocated for long-term care and rural remote locations. The vaccine distribution plan is divided into three phases. The first phase started December of 2020 up to March of this year, 2021. And the targeted population are identified as high risks. These are the residents, essential caregivers, as well as healthcare workers, adults in the First Nation, and adults recipients of chronic home health care. The second phase will start March of this year to July 2021. And this is the mass delivery of vaccine. This is where the seniors over the age of 80 and examples of essential workers will include the first responders, the teachers, and members of food and construction industry. And the third phase will be from August onwards, and these are to be given to remaining eligible Ontarians. Okay, so let's now have a conversation with our guests for today, and they can introduce themselves further. The first question that we would like to discuss is about your thoughts about significant or any drastic changes that is happening, that you felt like is happening in the nursing profession in general. Maybe we can start with our gentleman for today, Humphrey. What are your thoughts about this significant changes or any drastic changes that you thought is happening, right, in the nursing profession? You can introduce yourself as well, and from there you can, give your insights.
Okay. Hi, everyone. My name is Humphrey. I'm a registered nurse by profession. I'm an active USRN in the state of New Mexico, and currently I work at Sunnybrook Hospital as a safety officer at the Trauma Bay. So my role there right now is actually in response to COVID-19. Uh, these are some of there are two roles that were introduced to make sure that it's actually part of the COVID-19 strategy for the staffing. So they introduced ACPs, which are alternate care providers that they help with patient care. They are regulated and unregulated healthcare providers helping out with the nurses. And for us, safety officers, our role is primarily to make sure and to advocate the safety of our staff. We make sure that they don and doff properly and they practice infection control and prevention strategies. So, with regards to your question, Annalyn, there's been a lot of uh, changes when COVID-19 came in. Like, it was a constantly evolving situation, and in response, I think the nursing profession has been evolving as well. And I think moving forward, the focus would be meeting on our issues with human resources. I think we all agree to that we have problems with staffing. A lot of our nurses are working so hard right now, and probably a possible change in the policies, like here in Canada. Maybe they can speed up registration processes with the College of Nurses of Ontario. And secondly, I think we have we also need to address logistics when it comes to PPE, and especially right now we have the vaccines. It's important for us to have herd immunity in the future, which will probably take time because of our problems with the demand and supply of our vaccines. And I think most importantly, education, because for sure this will stay for a while. So it's important that we continue to educate the people to practice social distancing, to make sure that they keep themselves healthy, to wear masks all the time, because the collective herd immunity would be like 2, 3 years from now, which is a lot of time. And the virus itself is like evolving too. So there are like 4 strains right now. UK, we have one in California, we have Africa, and Brazil. And those are my thoughts.
Yeah, but truly, there's a drastic, right? A significant, we never thought about like positions, like a safety officer, and ensuring, that things are done, especially you're working in a trauma center, right? So that must be a rewarding experience for you. Okay, thanks, Humphrey. Now we can go to Beth. So what are your thoughts around those changes, drastic changes that's happening in our nursing profession?
I will not deny. At first, it's like a mixed emotions. Initially, when COVID came in, like, what is really COVID? What is like this kind of virus? So, for 16 years as a nurse, we've been exposed into viruses, especially back home. But then we're just shrugging off our shoulders, and then, oh, we're gonna deal with this. There has to be a solution for any problems. But then this COVID is different when we came to know that, oh, there's a lot of people dying all around the world. So it's really scary. So what are my thoughts about this? It's scary to the fact that we as nurses, we are frontliners, and that what will happen if we will catch the coronavirus? So what will happen to our family? What would be the impact to finances? But then after all those mixed emotions, now that there is like vaccine, really hoping that these changes in nursing profession would somehow would not really affect the lives of so many people, especially to the nursing profession. I know for nurses who's been working for 2 to 3 jobs, they can only choose one job, and how would that affect to their finances? And for nurses who has been into profession for so long, for those who are those ages who are very potential for catching the disease conditions. So there's a lot of things that
Mm-hmm.
into my mind about this.
Mm-hmm.
But hopefully,
Yeah.
we can do something about this.
Mm-hmm. And we're so happy and we're so lucky, that we have implementations rolling out of vaccines. And as Humphrey have mentioned, the demand, right? The increase of the
Yeah,
demand and the supply is there. So we're hoping that we're going to get, the second batch, of the healthcare workers to get their second, a vaccine, right, to complete the 95 to 94 to 95% effectivity of the Pfizer. Okay,
yeah.
so let's move on to Miss Sarah.
Hello, bonjour. I'm Zara Fortich here in Montreal, Quebec, Canada. So, just a brief introduction about myself. I'm a nurse for 8 years, but since I came here in Canada, I have not been practicing my profession. And by the way, I am a multi-license RN holder, Philippines, Singapore, Texas, USA, and here in Canada. So back to your question, my thoughts, my honest thoughts. It it was like a life irony for me because being an IEN or internationally educated nurse, I really persevered to integrate myself back into the profession. But when I finally got my RN license in Ontario, it was April 1st, Fool's Day. Um, the pandemic already debilitated the entire world. I was scared, to be honest. I don't know what COVID is. So, however, as Florence Nightingale quoted, let us not consider ourselves as finished nurses. Um, we must be learning all of our lives. So that's it. This is it. The pandemic hit us hard and taught us well. However, due to the overwhelming cases, I would think one of the drastic changes that's happening in the nursing profession, nurses gets the gets to be more independent on their management, and most likely nurses on triage or in ICU might soon take the burden of whoever lives or dies, and that's very daunting and difficult to deal with because not all hospitals can accommodate all the patients, and it's not all about COVID. It's there are also other clinical conditions that needs medical attention. So that's just my take on this. But on the brighter side, uh, there is this sense of solidarity for common goal, and that is to care and to keep others safe. So keep your distance, put a mask on when you're out, and make it a habit to wash your hands and sanitize your hands. And that's it. We can do this.
Mm-hmm. You
Yeah.
can do
Thank you.
this, right? So it seems like with the thoughts I'm hearing from our guests for today, they already have made some modifications, right, in regards to their profession and how to take care of the patients. But I would still would like to dive on that, right? Hearing again from our guests about the modifications in healthcare, as we're facing this global pandemic. So, what are your thoughts around how do we prepare? We know we are not prepared for this global pandemic, but as we are now in that moment, of having this global pandemic, so how are you preparing, for the modifications, in our healthcare as we speak?
Um,
Who would like to?
can I start?
Humphrey?
Uh,
Yes, sure.
Based on my experience, since the pandemic started, everything was mostly like virtual. So we'd be seeing more careers in nursing going virtual as well. There would be virtual care. Um, the culture has changed when it comes to being sick at work. So right now, if you just have a simple cough or a runny nose, go home, get rest. We don't want your virus here, right? So that
Right.
has ultimately changed the way we tackle staffing, the way we tackle scheduling as well in the nursing
Mhm.
profession. Thirdly, there's a growing demand for mental health. I think this is true for everyone. COVID-19 has been really hard. For me personally, it has been difficult because I used to work in long-term care and with home care. But unfortunately, with COVID-19, I'm not able to work. My hours were cut short. And luckily, there was an opportunity for me at Sunnybrook. So I took on the role, although it's very risky because, as what I've said, during that time, we still don't have a vaccine. And hopefully, once we get the supply of vaccine, this will be equitably like given to healthcare providers and those who are considered high risk individuals or the priority individuals who should have the vaccine.
Mhm.
So personally, with these modifications, I'm preparing myself. Being in the front line since the pandemic started, it's always to keep myself healthy, to focus on my mental health, to make sure I get enough sleep every night. Uh, I do a little exercise and so trying to improve it, making more time for it. And I think being virtually present, like staying in touch with your family and friends, that would be a very big help. With your colleagues,
Mhm.
it's important that you share it. I mean, we are apart right now, that's for sure, but you're certainly not alone. So it's important to talk about those feelings and be open about it. It's also good
Mhm.
to do some charitable work. It's good for the heart, and you can do volunteering. Personally,
Mhm.
I donate blood at the Canadian Blood Services. So I've been very consistent since I arrived here in Canada. After a year, I started donating, and even with the pandemic, I still donate blood and even registered for the stem
Mhm.
cell registry if ever anyone needs help or has
Mhm.
cancer.
Yeah.
And I think
Yeah.
being mindful and being practicing gratitude, I think that's very important because uh,
Mhm.
there are a lot of people out there who are very unfortunate. They don't have jobs. Businesses are closing, and nurses are overworked. So it's important for us to
Mhm.
really stay strong, have that, tell a story of positivity, and make sure that we keep moving forward because
Yeah.
this will take time, but together
Yeah.
we can
Mhm.
make make things possible.
Yeah. You're very true, right? Self-care is critical. We have to care for ourselves so we could be healthy enough to care for others, right?
Exactly.
What about you, Miss Marybeth?
Yeah, for
Any
us,
modifications preparing for the healthcare?
yeah. For most of us nurses, we are thinking that, oh, I can do 16 hours job and it's fine with me. No off. Um, what the pandemic is telling me is that we are frontliners. We are considered as the heroes, so we cannot get sick. Aside from being a nurse, we have a family. I have kids, so
Mhm.
physically, I should be healthy, eat the right kind of food, um,
Mhm.
right amount, no diet,
Mhm.
and adequate rest and exercise, and
That's
extra vitamins. Like
mhm.
you
Yeah,
have
it's
to.
self-care, right? Yeah.
Yeah, it's
Yeah.
self care.
Ensuring, yeah, that we're very healthy, right?
Yes,
You know,
yes,
yeah,
and
especially with, yeah.
mental
I'm sorry, Mary.
preparedness as well.
Yeah, that's what Humphrey have mentioned, right? About the mental
Deal.
health, which is very critical, right, for us to move on with this global pandemic. And I thank you for that. So let's talk about now some of the innovation, any interventions, um, that you notice, right, in your institutions, in your facility, like Zara is working in a teleperformance in Montreal. Have you seen any unique or innovative any initiatives, interventions that the company had been created, for us to facilitate on how we can help our listeners, right? On how they will be able to cope up, with this COVID-19 scare, because people have different feelings toward this. So there's always a fear, or scary feelings, towards the unknown. And Sarah, what about your institutions? Do they have anything, innovations,
Uh,
that our listeners will be able to gain some knowledge?
oh yes. I am very blessed to have a job that kept me financially stable and safe, as our company really prioritized to transition us to work home in perhaps I would say like few weeks or just within a month. So the lockdown, like total lockdown here in Canada, was around March, and I remember working at home starting March. So it was very very quick, and that is just amazing. Their quick take on the pandemic save a lot of us. But I understand it is not possible for some jobs out there. However, I see establishments comply to reinforce their clients or their employees uh, to keep distance, wear a mask, and sanitize their hands. So I would believe innovation is really the mother of necessity. When during the lockdown, I have thought of like doing groceries online, which I never do before, and those things. And also there will always be ways to endure this pandemic. um as long as we all do our part, each one of us, it creates a dynamo effect and a collaborative effort to cope up together as mankind. So I think if everyone will just cooperate, we can get through this.
Mm-hmm.
Yeah. So
Yeah, that's right.
mm,
Yeah.
mm.
What about in Sunnybrook, Humphrey?
Um,
Any innovations, or something, that will help, our listeners, when they deal with their own struggles, their own fear of having COVID?
as far as I know, Sunnybrook has mental health supports and programs,
Mm-hmm.
so you can check it online. We even have like virtual care that is provided by the Department of Psychiatry, and we have resources there where you can check what are the things you can do to cope up with the stress during this pandemic. Right now at Sunnybrook, I'm aware that they just opened the COVID multi-care clinic. It's actually an outpatient clinic for those who are COVID positive. So if they want to
Mm-hmm.
have themselves checked with a doctor. And this is also available for those who are under investigation there at Sunnybrook. And we have our assessment center that's open every day, 7 days a week. And that's for having yourself checked for COVID. And they're in, I saw this in LinkedIn. They advertised um, a virtual simulation program that's available for the Ontario hospital teams. This is a program designed to help communicate effectively with a team-based model, uh, especially right now with the COVID-19. So they're actually like trying to help hospital teams become successful in their response to COVID-19, especially when it's in a high stress area in the hospital. Let's say, like for example, where I work, the trauma bay, the emerge, or anywhere else with uh, like a code blue or a rapid response, right? So
Mm-hmm.
you can check that to the Sunnybrook Canadian Simulation Center website for more information.
Mm-hmm. Yeah, that's very good, right? All these resources, and it seems like we are really heading to online, right? As Sarah mentioned about, getting groceries through online, and like reaching out to our population, using the resources by the government as well as resources by our own institutions. Do you have anything to add, Mary Beth?
I think it has been mentioned. Everything has been mentioned. It's the same thing.
Okay, great. Thank you. And any words of advice to our listeners from your nursing perspective um, on how we'll be able to get through this global pandemic? Maybe we can start with Sarah because you are working in the teleperformance, right?
Yes.
Any words of advice, for our listeners, in your own perspective?
Yes. Actually, being an emergency personal response associate, so what we basically do, we send help to those who need, like send an ambulance, fire, or police, or anyone. Um, I find it a fulfilling job, to be honest, because I'm able to send help remotely, especially to the vulnerable community in the society. It may not be the highest paid job out there, but if you flip the coin, I see the other side. I I see a different perspective, and I made a difference to someone's life. So I hope you all try to see in whatever you do, you are doing great. Keep it up, stop whining, hustle hard, don't stop, move forward always. And another thing, just to add, um, I already have my RN license, and a lot of my folks question me like, "Why are you still there in the call center? Why are you still there? You can start working as a nurse." So I would just like to emphasize that you have to focus, or I have to focus first on self awareness before I can be an efficient nurse. I want to be honest with you. I was scared when I knew about COVID, and so I have been working here in as a emergency response since I landed as an immigrant. But when I got my RN license, I did not hurry myself being a nurse or be highly paid. I see getting myself back in the profession as more of like a commitment. So what I did, I spent quality time during holidays with my folks back in Philippines. I don't mind if I don't get to travel out. I would just like to be with them because it's been like 6 years, I guess. I have not spent holidays because of the nature of my job as a nurse and being abroad. And
Mhm.
that's just the reality of majority of us. So I'm back. I'm ready. I fully commit myself now as being a frontliner. I was an ICU back then, so I see patients die. I Most of them are not prepared, confused, neither their loved ones. But and so I really highly value self-awareness, to somehow prepare yourself, and eventually resilience gets in the picture when you are constantly in hot waters, like especially the nurses
Mhm.
right now, or all the frontliners out there. You're constantly in terrible situations. So self-awareness are ways that you consciously keep yourself well informed, educated, evaluate yourself, and it really helps you get prepared anything that life throws at you. So that's
Mhm.
it. Thank you.
Okay, great. What about Mary Beth? Any advice for our listeners?
Yeah, focus on what's important. Um, it doesn't matter what you do, you're a nurse or whatever you do right now. Focus on taking good care of yourself and your family, and be grateful. This pandemic has um, has a message to all of us, and we can do this by following the rules. Like right now, we are in a pandemic, a 1 month emergency lockdown. So it is necessary for us to just do what's important, essential. And cases are increasing. We cannot deny that. So um, focus on what's important. And we have to take
Mhm.
good care of each other.
That's right. And Humphrey,
I agree with
any?
everyone. I think it's important that we should be as frontliners, and even if you're not and you're working right now with COVID-19, it's important to recognize that your role is important to our society. Although it's with COVID-19, this has been a very big challenge for everyone. Um, it's important take care of yourself and your family. So it's important to still follow the health experts' advices. So stay home, uh, practice physical distancing, use a mask, wash your hands as much as possible. And
Mhm.
with mental health, it's important to stay connected. Uh, if you're not alone when you are like feeling down. So if you
Mhm.
feel like you need help, ask help. You go talk to someone. It's important that you are able to vent that out. For nurses,
Mhm.
definitely you are overworked. I know that lots of nurses are having two jobs, and even with one job, they still try to get more hours. So most importantly, you're caring for people, so it's important to also take care of yourself. So
Absolutely.
even if with even if you're vaccinated, still practice
Mhm.
physical distancing, because we don't know if the virus has mutated and if the vaccines would still work with the next strains that would come out, right? And God
Mhm.
forbid.
Exactly.
And on a education perspective, there's a lot of misinformation going around, like especially about the vaccines. Although they have been all pharmaceutical companies have this challenge of uh, with their clinical trials like hasten. Usually vaccines would take like 3-4 years before
Mhm. That's
before
right.
they're even rolled out to the public, right? But
Mhm.
with our current challenges, they have to hasten that
Mhm.
and to
Mhm.
address one
That's right.
second. So
Okay.
yeah, so
Okay. Yes.
that's it. Thank you.
Okay, great. So, as we conclude today's Healthy Monday, I personally thank our guests for today, Miss Mary Beth, Zara, and Humphrey, for joining us despite their busy work schedules. They have shared their personal experiences as we face the global pandemic. This is Annalyn, your guest host for Healthy Monday with APINA of Nevada. I will see you soon. Stay safe and be healthy. Goodbye.
Thank you, Emily. Thank you.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with APINA of Nevada.